Welcome back to Great Day Washington. If you or a loved one is living with type 2 diabetes, you'll want to pay attention to our next segment. Today and This Week in Wellness, we're introducing you to a new approach to treating type 2 diabetes, and they say the condition can even be reversed. I'm joined by Drs. Tom and Steph Chaney from Living Health Integrative Medicine. Great to see you guys again.
Good to see you too.
Dr. Steph, when you start with a patient, what do you look for? How do you track somebody's blood sugar?
Well, generally, most diabetics are tracking their own sugar with a glucometer or a blood sugar meter, and they're looking to make sure that their ranges, are in normal range. A normal range for a blood sugar meter would be anywhere between 85 and 100. Okay. We're really targeting below 100 on a regular basis. And then the doctor will generally track blood sugar or diabetes with a marker called hemoglobin A1C, which is a blood marker that tells us how well you're controlling your sugars over a period of time. 5.7 or below is considered normal. Okay. Above 5.7 to 6.4 is pre-diabetic, and 6.4 or higher is considered diabetic.
Okay, so you've got the blood markers, you're tracking that, but Dr. Tom, the blood sugar and those numbers is just kind of part of the story, right?
Exactly, it's just part of the story, and what I mean by that is that it's kind of like the check engine light in your car. Like if your check engine light comes on, you know there's an issue with the engine, but we have to take it into the mechanic. The mechanic has to look under the hood and say, okay, what is the problem? So that's our approach. So we're going to run some diagnostic tests that aren't typically run. We have found that there's different organs, glands, systems that have their hand in helping to control blood sugar. So we're going to assess all of those for each individual to figure out for them specifically what different areas do we need to correct and get more functional.
So you're diagnosing that, and because we know something's up,
yeah,
but you're the ones figuring out what it is.
Yeah, it turns out medication alone is not going to generally stop the progression and acceleration of this disease. Okay. And even back as far as 2011, some research published in the New England Journal of Medicine showed that trying to drive hemoglobin A1C or sugars down with aggressive prescription intervention actually resulted in patients being more likely to be dead in 5 years, usually due to a cardiovascular incident like a heart attack or stroke. So we know simply attacking it with medication is not a good long-term solution. And so we take that multifaceted approach, a natural approach, a functional approach, just trying to get the body functioning optimally on all cylinders. And then what happens is the sugars come down, the blood pressure comes down, the sugars come down, the weight comes down, the cholesterol comes down, and people are actually able to be weaned off of many of their medications, and their diabetes is effectively reversed.
Can you elaborate on that a little bit more? Because I know you probably get questions like, is this really a long-term fix? It's just a fast Band-Aid kind of thing. So Dr. Tom, how does this continue to be long-term that you talk with your patients, work with your patients?
Yeah, we want to actually give them the tools to be healthy long-term. So not only do we see patients reverse this disease, but also we're able to see them maintain it. For example, Jim Clifton, who was on the show earlier, he's been out of the program for a couple years now, and he's been able to maintain his blood sugar in a non-diabetic range. And because we've given him the tools, long-term tools, he knows for his body, okay, this is the blueprint that I have, this is what I need to stick to, this is what I need to do to maintain those numbers.
And not just masking it with the medicine.
No, in fact, Jim's been off medication. His doctor was able to take him off all of his sugar medications, and he's been off them for 2 years, and his hemoglobin A1C is in the 5.3 normal range. So he's non-diabetic, and he's been that way for a while.
And I know every time we see him and talk to him, he feels so much better. He has so much energy, and I think too with the patient, getting started with you and then continuing, it just builds that confidence that, okay, I don't have to live like this. I can live and be healthy and energetic and feel good. And Dr. Tom, I know you guys always have such great information, but you have a couple seminars coming up? Yeah,
so for more information, viewers we have a seminar coming up this Wednesday night, so Wednesday evening, and then Saturday at noon. So for more information, come there. We give a lot of valuable information. So
free seminars, right?
Free seminars, absolutely. And we're actually giving these next two seminars. We're giving away a copy of our book, Defeat Diabetes. So you get a free book, free seminar. We want to help at least 1 million patients reverse this disease by the year 2020. That is one of our goals, and we're on a mission to do that. And that's where you can get more information.
Awesome. Our favorite 4-letter word, free. You can learn more at diabetesreversalseminar.com. Now, one is being held this Wednesday at 6 p.m. at the Courtyard Marriott, Annapolis. The next one is taking place this Saturday at noon at the Bowie Comfort Inn. Call 888-514-4771 to register or visit diabetesreversalseminar.com.